This presentation is called Healthcare Around the World, the United States versus the World for Global Society. The first topic I want to talk about is health as a human right. For many people, they believe that their health is their right. The World Health Organization in 1946, its constitution defines health as a state of complete physical, mental, and social well-being, and not merely the absence of disease or infirmity. Those three pillars of physical, mental, and social well-being are the pinnacle of how they're defining health. With those three things being equal and not physical ahead of the others or mental ahead of the others. But the World Health Organization goes on to state that the enjoyment of the highest attainable standard of health is one of the fundamental rights of every human being without distinction of race, religion, political belief, economic, or social condition. The attainable standard of health is one area that they are striving to increase to be more quality of your visit with your doctor rather than the number of patients the doctor sees in a day. The other thing that I want to point out that the United States falls back on compared to other countries is that of the economic condition. With the United States, they have a free healthcare basically, where any company can choose any plan they want. It could be Humana, it could be United Healthcare, Blue Cross Blue Shield. And based on that choice, the employee can either take it or decide not to take the health insurance. With that information in mind, it comes into play with the economic well-being of the cost of a procedure may outweigh the person's desire to have that procedure done. If they know they can't afford it, they would rather choose not to have that procedure and live with the ailment or infirmity for a longer period of time than should be necessary. To try and combat the people that don't have health insurance, either they do not qualify for Medicare, which is for elderly 65 and older and disabled, or Medicaid, which is based on the income of the family. They signed into law, President Obama, the Affordable Care Act in 2010. The Affordable Care Act stipulates that everyone should have insurance, either it be Medicaid, Medicare, insurance through the person's work, or private insurance that the person chooses to purchase. With the Affordable Care Act, for those not qualifying for Medicaid, there is the option to have assistance to help pay for their health insurance premiums. Whereas a family could receive anywhere on, for example, $250 off their premium each month, where that comes from their taxes. Since the start of the Affordable Care Act in 2010, where it went into effect in 2013 and 2014, there have been over 16 million people sign up for the Marketplace plan. Of those, many of them are getting financial assistance. About 12 million of those that have enrolled are getting financial assistance for their premiums. Of those 16 million, 5 million were determined that they would qualify for Medicaid in the states that they lived in. And a number of the individuals selected a plan was 12.6 million. Now, in the past, with the economic condition being looked at still, the healthcare costs in the United States has increased. Data shows that the health spending has increased by 7.3% higher than the first quarter of last year. With that increase, that puts more burden on the person and their ability to pay for their out-of-pocket expenses. And that would be their coinsurance, their copays, their deductibles. When a family has to determine if they're going to have a procedure done or put food on their table, they would probably go with the food on the table. The other thing that we would look at is that there is a greater use of the health services since the implementation of the Affordable Care Act. Hospital stays are increasing in length, which causes a financial burden. Most insurances would cover 80% of the hospital stay, whereas the patient would be required to come up with the remaining 20%. Most facilities are willing to make payment arrangements, but it still puts a financial burden on that person and that family. There has been more use of physician and outpatient services rather than going to a hospital. This does not cause as much as a financial hardship for the person, but it still causes one in general. Some of the options that other countries have gone with that have seen a significant increase in the health of the nation is that of universal health care. With universal health care, it's the goal to ensure that all people obtain health services they need without suffering financial hardships when paying for them. That's also from the World Health Organization. The universal health care is firmly based on the Constitution of 1948 by the World Health Organization, declaring health a fundamental human right, and on the Health for All agenda set by the Alma Ata Declaration of 1978. With that as the definition of universal health care, those countries that participate with universal health care reduce the financial hardship for the patient and their family when they are paying for their services. They may only have to pay a copay or a small coinsurance rather than a 20% coinsurance for those services that were provided. With universal health care, these are some of the achievements that must be in place to be considered as universal health care. One is a strong, efficient, and well-run health system that meets priority health needs through people-centered, integrated care, including services for HIV, tuberculosis, malaria, noncommunicable diseases, maternal and child health. And the way that they would do that would be informing and encouraging people to stay healthy and prevent illness, dictating health conditions or detecting health conditions early, having the capacity to treat disease, and helping patients with rehabilitation. The other main aspect that they need to have in place is affordability, a system for financial health services so people do not suffer financial hardships when using them. This can be achieved in a variety of ways, and it's based on the country on how they would achieve it, but it has to be affordable for all. It doesn't matter if they're the wealthy or the poor in that country, it has to be affordable. The other goal that needs to be in place is access to essential medicines and technologies to diagnose and treat medical problems. And the last one is a sufficient capacity of well-trained, motivated health workers to provide the services to meet patients' needs based on the best available evidence. So this means that they have the best care available to them. It doesn't matter if they are the wealthy or if they're poor. With the universal health care, there are arguments that it does impact the individual's human rights, whereas the wealthy are paying more for it than the poor, whereas the wealthy will pay for it and the poor don't have to make as much as a contribution but still get the same care. Another argument shows universal healthcare systems enable everyone to enjoy a freedom, whereas when you are healthy, you're able to do more and enjoy your life without the ability to hinder yourself by not being able to travel and enjoy certain things. Across the world, most wealthy nations provide a universal health care for its citizens. The only exception to this would be the United States, whereas they still offer the other options for the person. There are pros and cons to considering universal health care. Like, does it infringe on human rights? Some argue yes, because the wealthy are paying more. Some argue no. What's the financial cost to the country or the person involved? That's something that would need to be looked at as well. What about those that are still not insured for healthcare through either Medicaid or their children health insurance program? With that, it leaves us to many questions that may be good for the United States, but it still may take time for it to work properly.